I don't get to say this very often, but today's guest has some ideas that may actually change your life. She has some thoughts and ideas about things that are going on in our society and with our children and with ourselves even that have some causes that people don't even think about. So I can't wait for you to hear from her. She's so funny. She's got so many great ideas and she's a great guest. Welcome Shirley Gutkowski to the Teaching Your Toddler show. Shirley is a grandma of three, a mom of five, and a wife of almost 50 years. She has all her own hair, stopped coloring it a year ago, and is the owner of Primal Air, a company that helps people get their face to work right. She's also the author of the first pre-parenting book focused on the development of your baby's face. More than a kissing spot, your new baby's face is a simple yet deep dive into all the things people need to know about their baby's mouth and tongue before they become exhausted parents. I can't wait for you to hear this show for if you're expecting, if you know someone who's expecting, or even if you already have children, you will get something out of this show. So welcome to the Teaching Your Toddler show. This is Mary Jo Tinlin from the Teaching Your Toddler Show. Today, we have a very special guest. Shirley Gutkowski is here to talk to us about a subject that you may or may not have thought about. I can't wait for you to hear more about it. Shirley, welcome to the show. First of all, why don't you introduce yourself a little bit and tell us about yourself and about your book?
Hi, Mary Jo. Thank you so much. Boy, a little about myself. So I'm a clinical dental hygienist by training, and I did that for 20 years or so. And then I launched myself on a completely different career of speaking and writing. And I did that mainly for professional audiences. And in 2014, I was at a course that changed my life. I was very adamant and proactive and very preventive oriented. And I learned about this thing called the airway. And I know, and as I was thinking my way through my career, I was like, wow, I probably looked at 10,000 throats in my everyday career, and I never saw an airway until the twice every 2 years we had to have CPR training, and I never put this two together. Let me see your throat. What does your throat look like? Red, not red. That was it, right? And so when I learned that I could be part of the solution on my own without having to work under a dentist, by doing myofunctional therapy, which is training the muscles in the snoring complex that have been affected in different ways, that I could be part of the solution to opening up the airway, and helping patients stop dental decay, periodontal disease, ADHD, sleeping better, sleep apnea. I'm finding that patients that go through our therapy don't have IBS, their constipation goes away. It's just so bizarre.
Oh my
And
goodness, that is a
it's
ton
really,
of
I
things
know,
connected. Wow.
it's so wild, right? And I was like, what am I doing? And so it's been super fun to be able to help these patients or these people out. And then the more I was seeing 60-year-olds who presented to me with a tongue tie, I was like, this has to stop. And then I would see 8-year-olds who had tongue ties. And then I don't really like to see babies. It's not my, I have a grandma thing, and that's about as close as I don't want to treat them. But I want parents to know what's going on and what has happened to their child, and that they are not all wet and that they're not crazy. The way that new mothers are treated with respect to breastfeeding is jaw dropping. I mean, I think that's the second time in 2 minutes that I said jaw dropping, but it's really true. It's really nasty. A lot of blaming and shaming, a lot of what do you call it? Outside forces
Mhm.
that are just give them a bottle. You can pump. So in medicine in general, they finally have agreed that breast milk is best. but it's the breast and it's the whole thing that goes together. It's how you hold the baby and interact with the baby and the eyesight. And it's just massive. And when you take the milk and put it into a bottle, you're introducing a lot of problems and or ignoring problems that are existing right now.
Mm-hmm.
So then as I was thinking my way through, I talked a friend of mine into becoming a lactation consultant, because that's another thing I don't want to do. Just want to be like, just
So you just
awareness,
got your friend to do
awareness.
it. I like it.
And she was like, oh, I can't do it. I had the worst breastfeeding experience of anybody I know. And I was like, that's what would make you perfect. And so she was a really good example of, the amount of anxiety. She's one of those natural people that, gets a cow from the farmer down the road and all of that stuff. And then she couldn't nurse her own child. And even at the time and then how do you say it, right? Because you just had a perfect baby, or your friend did, or your granddaughter or whoever just had a perfect baby. They're not nursing, and there's a solution to not nursing, but they make you feel terrible the whole time, because this is what I heard just recently. Your breast milk doesn't have enough calories to support the baby. How is that even possible? Flat nipples, fat nipples, long ones, short ones, inverted ones, boobs are too big, boobs are too small. It's just on and on and on. And what I started to see was that the problem was the pre-birth.
Okay.
After you have a baby, you're completely wiped out. You may have been in labor for 36 hours, very common for over 20 hours, right? I don't know. My baby's now 40 something. I don't know exactly how many hours, because you do it wipes out of your head, right? Unless you're on Everybody Loves Raymond's show, because she knows exactly how many hours.
I forgot that.
So some people remember. I mean, if they complain about it all the time, then they will. But shortly, you just forget, and you just are so happy to have a baby, and he's so cute, and he's adorable, and yada, yada. And I'm looking at the baby, like on Facebook, all of these baby pictures come through, and I'm like, oh my God, oh my God, oh my God. And, you can't say anything to a new mother about that. So I wrote a book called More Than a Kissing Spot, Your New Baby's Face. I wanted it to be short. I wanted it to be concise. And I wanted to have pictures in there of babies who are breathing with their nose. I don't know if I've ever seen a baby breathe through their nose until my little grandson, my latest one, he's 3.5 now. Every picture they sent me, he lives in North Carolina, I live in Wisconsin, his mouth was closed in every picture. Like, I didn't know that was a thing. And it is a thing, and that is primally how we are intended to be. We are intended to breathe exclusively through the nose. The mouth is for eating and communicating. The mouth is the escape hatch or the emergency hatch for a problem with the nose. When the baby is in utero, I want mothers to know this, the tongue is supposed to separate from the floor of the mouth at 12 weeks gestation. So it's pretty early. It's a process. This is one of my favorite words. Write this down. Apoptosis.
Oh, I love that word too. Mm-hmm.
Isn't it great?
Mm-hmm.
So apoptosis is supposed to occur and separate from the floor of the mouth, and then you are supposed to be able to use your tongue. What does that look like for an infant? Well, it looks like, so the tongue is pressed into the palate. If you've ever tried, and I tried with little Malcolm, to open his mouth when he was sleeping, couldn't do it. It was just pinched shut. And I was like, that's interesting. So that's where the tongue is supposed to be. On those really cute sonograms where the baby is sucking his thumb or her thumb, that is a closure of an open neurological circuit. So you have nerves in your palate and you have, I can't do it, nerves in your tongue, and they're supposed to be closed.
Mm-hmm. Okay.
So if there's a breast in between, that's one thing. Otherwise, the tongue is supposed to close that. If it's open, you're in that fight or flight kind of a situation. So, all of this stuff you can't tell a new mother. And then the father's like, yeah, but the other white coat said you're just overreacting. So I addressed that in there too and I used some PC language. I said the non-birthing parent, because you just never know anymore. But we want these poor mothers to know this in advance and to put it into their care plan. These poor women are not only badgered, first of all, they just had a baby, fun times. Then they go to the doctors and the doctors tell them they're all wet. Their husband has to believe the doctor because he already knows that you're all wet. But there's this very, very tight interaction with the dyad between the mother and the baby. And that word dyad, I don't know that I've ever heard it used in any other context. It's very rare, but it's an interaction between two humans, two beings, and the baby is very unique, and the dyad between the mother and the baby are extremely unique. If you really think your way through how this whole thing is, babies are born to humans approximately 6 months premature as compared to other mammals. So that is why it is such a tight interaction between the mother and the baby. If the baby is hurting the mother during nursing, that's a red flag about the baby. It's not a red flag about the mother.
Right.
So the baby must obviously have something wrong with their mouth, and almost always it's because of a tongue tie. So I would prefer, if I had my way, that there wouldn't be any tongue ties. So, if you have a magic wand, let's go there. But in the meantime, it would be nice if these mothers would understand that during their pregnancy time, so they can include it into their birth plan so that they don't have to spend months and months and months looking for someone to make an assessment and agree with them and then release that tie. Every minute is another hour for the baby, right? Because they're growing so fast. And when you breathe with your mouth open, you don't get the right amount of oxygen mix. And your brain is very sensitive at that age to oxygen levels. So
that
that's
has a lot
why
of
I wrote the
downstream
book.
effect, clearly,
Oh,
right?
yeah.
Yeah. So I have a question
Yeah.
before, when you're talking
Yeah.
about tongue tying. So my oldest son was tongue tied. Like I could still see the tendon and everything, and we got it snipped when he was
Good.
like a week old. But are you saying, can you have a tongue tie where you wouldn't necessarily see that kind of thing? It wouldn't be as obvious?
Yeah. It's difficult for some people to see the tie. Now, you may have heard the term posterior tie. So in dentistry, so that's our word. In dentistry, we divide the tongue into thirds: 1/3, middle third, back third. In ENT and in medical circles, this is the posterior of the tie that goes, or posterior of the tongue, it goes down the throat. So they get kind of wigged out when we say posterior tie. So if you're speaking with a physician, I would not use that term or ask, do you think he has a posterior tie? Because they're thinking this.
All the way down the
So
throat.
yeah. So and this part I just learned about, so I didn't get it into the book. So the term is mid-tongue restriction.
Okay.
Okay. So if the tongue doesn't stick out at all, that is usually what people are looking for. The tongue can be tied so that the tip is folded over, like that. It could be that frenum could be all the way to the tip, could be in the middle and short.
Okay.
If it's short, that's what makes it hard to nurse. So
Gotcha.
not just the forward attachment, but that short attachment.
Okay. Okay.
So how is your child doing now? Because a lot of times that release has to be redone when they get older because it's so adjusted.
I mean, I think he's fine because he's 24.
Oh, there you go. 24.
Yeah.
Yeah. So yeah, there you go. Is he snoring?
I don't think he does. I don't remember from his childhood being bothered by that, or him being bothered by it either. I'll check with him, but yeah,
Yeah.
yeah.
It's just so disheartening when I have these older patients that have these really restricted tongues and no one's ever done anything.
Hmm.
Currently, what they're saying is that still only 4% of the population has a tongue tie at birth where they take care of it. And I'm like, okay, but everybody that walks in here is not an infant. They have obvious tongue ties and nobody counted them.
And that's way more than 4%, I'm sure.
Yeah.
Yeah.
So it's just so frustrating.
Hmm.
So when let's finish talking about the development, which I do kind of go through in the books because you kind of have to know why it's important. Who cares?
Hmm.
Some people can even nurse with a tongue tie, with a baby with a tongue tie. And so the pressure of and why the breast is so important, the pressure of the breast against the palate expands the palate. The palate, ta-da, is also the floor of the sinuses,
Ah, okay.
right? So that's where the breathing part comes in.
Hmm.
And then the tongue pressure, when the breast isn't in there, is competing with the pressures of the cheeks and the muscles of mastication. So there's a good balance there, and that's how you get good, nice, straight teeth. And that's why all the skulls you see of prehistoric people all have enough room to put another tooth in the back here, right? And we have to have all of our wisdom teeth out. So that's the big upshot there. You need to have enough space for the tongue to work so that you get good development of the upper arch,
Mm.
that you have a good low vault. The higher up the vault is, the worse it is for your sinuses.
Sure, because it's pressing into your face. Yeah.
Yeah, exactly.
Hmm. That makes sense.
So
Gosh, it really, I mean, it makes a very strong case for nursing your child, doesn't it? Because of that just facial development. I mean, their head is already sort of malleable in order to be birthed, right? And so that
right.
whole thing is still moving around. And so, wow, that's amazing.
Yeah, it's really critical for sinus development. This bone here that holds up your teeth, and there's a hole here for the sinus, but that same bone is behind the cheekbone and it holds up the orbits.
Hmm.
So
Oh,
your eyeball too. So if that doesn't get into the right position, then one eye might be a little bit off center, or the ball of the eye may be squeezed in a way that screws up the vision.
oh,
I mean,
wow.
this is not nothing, right? This is a
Right.
really big thing.
It
And
is.
this is this is why I really need for these kids to really have parents who get it so that we
Hmm.
can take care of it.
Wow.
When
Yeah.
you're 60 and when you're 50 and when you're 40, it can cost almost $80,000 to repair.
Wow.
It's unbelievable. Wait, it's unbelievable that we can repair it. First of all, that's
Hmm.
amazing. But you need to have a second full-time job in order to pay for it. A lot of this
Yeah.
stuff is experimental, or it
Sure.
is not covered by your insurance plan or something like
Mm,
that. So,
hmm.
so
I mean,
that's
is it
that's
causing
really it.
sleep apnea? Like you have to wear the CPAP and all the things like that? That's the kind of thing
Yep.
you're talking about with the 80,000 and surgery, I'm sure. And
It's a surgical procedure. So
okay.
they cut the maxilla, they move it forward, they cut the mandible to move it forward as well, or they wear a gadget, an adult gadget, to expand the arch, which is a long, not fun
My
process.
daughter had to go through
Or,
that.
yes, see? So you wonder, is her tongue maybe low?
It's possible. I mean, that's my son that had the tongue tie. That's his sister. So, I mean, it could
In the
be for
family.
sure. Yeah, right. And interesting. I'll have to check because actually their grandma, now that I think about it, my former husband's mom, she had the short tongue. She wasn't necessarily tongue tied, but
Oh,
she couldn't stick her tongue out. So, I'll
that's
ask.
also a tie.
Yeah,
That's one
right.
of the more obvious ones, at
Hmm.
least, you know.
Hmm. Yep. Yeah. Oh well,
So
interesting.
yeah,
Hmm.
it's really astonishing. So how is it that there are so many tongue ties right now?
Right.
Is the question number five, I guess, and that has to do a lot with the food that we're eating.
Ah.
And yep, and so you don't have the nutrients you need to get that apoptosis to occur completely so that the tongue is free. And
Mm.
now we're in this fourth generation of a non-species specific food, right? So I fed my kids cereal that was their first food. My
As we
older
all did, right?
grandchildren's,
Yep.
yeah, that's what we
Yep.
all did.
Hmm.
And because that's what they told us to do.
Exactly.
I don't know who started it, but kids before the 1900s didn't start that way. They started with pre chewed food from their parents, or they just played with the food until some of it went down, which is now called baby led weaning, now that we have a name for it. It's
Yeah.
ancestral eating and the
Hmm.
chewing. There's no food that requires chewing. People are drinking a salad. It's just nutso that you just don't think about the chewing component that's missing.
Hmm.
So
Hmm.
yeah, there's a lot of little fingers that come off of this topic for sure.
Wow, that is amazing. So now you mentioned like ADHD. So what's the tie to that and eventually?
So okay, so if your tongue is tied, you have an airway that's back here. You have an epiglottis that flips down so that your sandwich doesn't go into your lungs, right?
Hmm.
And if your tongue is tied, it's tied into the airway.
Ah.
So it's slumped backwards into your airway.
Hmm.
And that's what's called, well, eventually called obstructive sleep apnea. And you can't tell the difference between obstructive sleep apnea or any other kind of sleep apnea in children from ADHD. Nobody is doing these tests. They're just putting them right onto these pills.
So it's being diagnosed as ADHD. It's not necessarily ADHD. It's actually a sleep disorder or a
Very
breathing
commonly.
disorder.
Yep. Yep.
Wow.
But if they're not looking.
Yeah, no, exactly. That's
And
crazy.
there's not enough pediatric sleep physicians.
Hmm.
So, in order to get a child to go through a sleep study, is maybe 6 months or more out. And
Wow.
then to have it read and do something about it. And you know what they do about it? So, let's say your 7-year-old has sleep apnea, put them on a CPAP.
Oh, even at 7?
Yeah.
Wow.
So, if that's occurring to the people in your audience, they should find an airway centric pediatric dentist who is not opposed to skeletal expansion in children, young children, 3 years old, 2 years old. Because you can see this already then.
Is skeletal expansion, is that a surgery or is it a
No,
therapy? Okay.
no, not at that age. It's a gadget that gets glued in.
Ooh,
And
okay.
because they're growing, right, they have to change it out a lot.
Okay.
So, but
Hmm.
that's what needs to happen in order to get the face to grow so that you have enough room in your sinuses and keep the sinuses clear and make it easy to breathe through the nose and keep the mouth closed. We also see tongue thrusting in kids with tongue ties, so they have an open bite. So
Can
yeah.
you explain that? Because I've heard that term, but I don't understand it. Tongue thrusting?
So yeah, do you see how my teeth, the top teeth, are not covering a lot of my bottom teeth?
Okay. Hmm.
So that's minimal, like seriously minimal. It should be about 40% over.
Oh, wow.
Okay, so now if the tongue is pressing against the teeth, it when it's swallowing and it comes forward because it's tethered in the back or in the middle third, whatever. And then these teeth start to go like this.
Spread apart. Okay.
They spread apart, and then a lot of times they won't touch at all. And every time they swallow, you'll see the tongue stick out
Oh,
like that. So that's a tongue thrust.
okay. Thank you for explaining that.
So what they do now in orthodontics is they'll put something called a cage, or I don't know what else they call it right now, but it's like a little stabber on the back of the teeth to keep the tongue from, yeah, to keep the tongue from going there.
It's so it actually pokes your tongue so that you won't do that.
Yeah, I have a kid right now, one on each tooth, 1, 2, 3, 4, just little spikes.
Wow.
Yeah.
I've never heard of that. That's
Aren't
crazy.
you glad you got me on
Yeah,
today?
absolutely. You're fascinating. This is so much information I never knew. And I think that there's probably a lot of people that are going to listen to this and they're going to be like, "What? I've never heard this kind of stuff." So this is crazy and so like it's groundbreaking. It really is really interesting. Tell me a little bit about the nasal sprays that you recommend or and why.
So if your sinuses are small, there's little chutes that attach the sinus spaces together. And if they're also small, because they're small now, there's a mucus covering, right,
Okay.
that protects all of that tissue. And if it's swollen at all, it closes off altogether. So we need to keep that open as much as we can
Hmm.
during the whole time. So, and this is something that you can do for an infant right out of the gate. If they seem a little snotty, maybe you have a dog, maybe they're redoing the road and everything, the whole world is full of dust. So you want to keep these passages clear.
Hmm.
And we do that using a nasal spray called Clear. It's spelled with an X, so it really throws people off. Some people may know it to be X-Lear, but it's
Okay.
pronounced Clear. And every diaper change, you put a drop or two in the nose in an infant. You can, I think it's 6 weeks, 6 months. I don't know. It's a pretty tiny baby. It says right on the label there.
Okay.
And then just do that. And then for older kids, we put a spray to use to clean out those sinuses.
Hmm.
The Clear company has a lot of different kinds of nasal sprays now. We used to just have this one here. Ta-da! This is my own personal bottle right here in my office. And they also have stuff with some other ingredients like capsicum in there. So if it's really, yeah, it's spicy, I'm not trying it. It took me 3 years just to try this
I
one.
mean,
It's
isn't that the
so mild.
principle? That's in cayenne pepper, right?
Yeah, yeah,
Yeah.
right.
Uh-huh.
It's
Okay.
she's spicy.
Yep.
It'll make your eyes water too. So
Wow.
there's that. Yeah, and they also have a couple of other with ingredients, but they do have one that's in like a squirt bottle like this
Hmm.
instead of this pump,
Hmm.
and that's also can drop the nasal spray out.
For the baby.
Not every kid likes to have spray go in their nose.
Hmm.
My
Hmm.
granddaughter was like, "No, I don't want it."
Yeah.
So that was a fight almost every day.
Hmm.
But for an infant, you can put it just a drop in their nose. And really, if they're 5 years old and they still don't like the spray, if they lay down and you just drop it in there,
Mm.
that can work too. And
Okay.
it works in a really unique way. It thins out that mucus because you have to have it.
Hmm.
It thins it out so that it goes down your throat. So after a minute or so after you put the spray in, you can feel it kind of rolling down your throat. It's kind of cool and sweet. So there's that.
Because it's
And then
xylitol, right?
yeah, exactly.
Hmm.
And
Okay.
so you can feel it going down, and then over time it shrinks those tissues. So habitual use is 2 squirts in each nostril in the morning and at night, so twice a day. And after 3 weeks of habitual use, it's almost 30% greater volume of air that can go through.
Oh my
So
goodness.
that's
That's
pretty
significant.
amazing. Yeah.
Yeah. And it's like it's fine to use over a long period of time. Like it's okay.
Yeah. Yeah, there's no drugs in it.
Mm-hmm.
Um, the if you were looking for a problem, it uses grapefruit seed extract
Mm-hmm.
as the uh, preservative. So it's very clean. It's very accepted to all of the people in the natural food category.
Mm-hmm.
That's where
Mm-hmm.
they launched the product. It's still their number one product. They have toothpaste now and a bunch of other gums and mints and stuff like
Mm-hmm.
that. So
Mm-hmm. Yep.
yeah, so it's pretty amazing. I really like using it. And that was part of my lectures then to the dentists and the dental hygienists is how to use xylitol to stop tooth decay. It was invented as a nasal spray. You won't believe this, for ear infections.
Oh.
I'm
Well,
telling
I
you,
mean,
it
it's all
all starts
connected.
in the mouth.
Yeah, absolutely. Right.
Yes.
Okay, so the
So
spray was first, and then came the gum and the toothpaste and all the things.
yeah,
Okay,
yeah.
interesting. Mm-hmm.
So the eustachian tube that they
Mm-hmm.
kind of help, that's another thing. If your tongue isn't in the right place, those tubes are never going to grow either.
Oh,
Nothing's going to go.
yeah.
So Dr. Lon Jones' wife was a speech language pathologist, and her granddaughter was starting to show speech problems because she kept having ear infections. And so she begged and begged for him to find any kind of a solution. And he came across a couple of studies using xylitol for ear infections in chewing gum. And he was like, what about a nasal spray? Because it's right, the
Hmm.
eustachian tube fills or empties into the back of your throat.
Right.
And so that's what he did. And it solved almost all the problems for all of his child patients with ear infections.
Oh,
Yeah, it
wow.
was amazing.
That's a mom hack right there. That's
Yeah,
great.
no kidding. Yeah.
Wow. Yeah,
So he
my
made it in his bathtub. So you don't have to do that. You now get it from a sterile container in Utah.
yeah, at the grocery store, or I know I've
Yes.
seen it at like Sprouts or Whole Foods or things like
Yeah.
that, right? That is amazing. Wow. Oh my gosh. I'm looking at my notes. I'm trying to see if there's anything else that we should cover here. What else do we need to know before I let you go?
You can get the book on our website,
Absolutely.
primalair.com. So it's not on Amazon yet. I don't
Okay.
know. It takes a while to get on there. And
Hmm.
but I want everybody to get it as soon as possible and then to share it with everybody who's going to have a baby. You can see now why I was like, no, before.
Hmm.
Um,
Hmm.
and then, there's no wrong time, but certainly before the baby comes is a lot easier to manage.
Hmm.
Um, yeah, I think that's pretty much it. I think chewing is key. Make sure your kid is not focusing only on foods that just slip down your throat, like cheesy noodles.
Hmm.
Um, meat. Make sure they eat meat.
Yep. To chew.
That's it. I mean, I could go on for a couple hours, but I know that I just want to narrow it down to
Yeah,
just this
no, and
one little
we'll
topic.
absolutely make sure that we have all the links that you've mentioned so that people can find you, find your book, find some clear if they want to. Um,
Mm-hmm.
just before I let you go, I have one question to follow up. How is there a way, like in utero, that you can find out if there's an issue? Can they tell on an ultrasound or anything like that that the baby has tongue issues?
Well, first of all, they have to believe that it's a thing. So they're not going to look for it. And as I mentioned, probably the closest thing is if you get a picture of the baby sucking his thumb
Okay,
in the sonogram. That to me is like, really?
that's a little clue.
I don't know. Yeah, it's a
Okay,
little clue. Should make you wonder, should make your eyebrows go up. Yes, it's cute.
of course. But it's
All
also a
babies are cute.
sign. Yes, yes, right. Anything they're doing in the little ultrasound. Awesome.
Mm-hmm.
Well, Shirley, this has been such a pleasure. I mean, you have just like opened up so many new things for me. I mean, I thought I knew a bit about things, but you've really pushed me on this one because this is so much new information. I love it. I
It's a
love it. Love it.
deep
It's great.
dive.
Yes,
Yeah.
for sure. Deep dive. And it's like these mom hacks that I think are going to be so interesting for the audience. So I really appreciate your time today. Again, we'll make sure that we have all the links for people to find you. It's been a pleasure. Any final thoughts, any last words?
I really appreciate what you're doing. Moms need all the support they can get. The world is a crazy place, and you can stumble down some really black holes. And it's nice that there's some other light. And I think what you're doing right now is very enlightening and helping people in a lot of different ways. So I appreciate you giving me some of your time.
Absolutely. We appreciate it too to have you. Thanks for joining us on the show. Great to see you.
This has been the Teaching Your Toddler podcast with Mary Jo Tinlin. Thank you so much for joining us today. I hope you'll find us on our website at teachingyourtoddler.com, as well as on Facebook at Teaching Your Toddler, on Instagram, and on Twitter at Teaching Toddler. So join us again, and I hope you have a wonderful week. Thank you so much.